Well, one of Canada's worst environmental disasters is getting worse. A new study has found that mercury poisoning near the Ontario First Nation Grassy Narrows is becoming more dangerous, and it points to how community members have been getting sick there for generations. As Lorenda Redicop reports, pollutants from a nearby company are being blamed.
We've elected to release this data today because of the urgency of this situation.
A critical situation affecting the Grassy Narrows First Nation and others downstream. This study examined water samples collected from the English-Wabigoon River upstream from Grassy Narrows. Researchers found large amounts of pollutants were being added to the water system, meaning double to triple the contamination.
Every minute that there is additional discharge of this sulfate and organic matter into this river, more methylmercury is being formed.
Methylmercury is even more toxic than mercury. This University of Western Ontario researcher says it's being created by a mix of sulfate and organic matter, plus mercury already in the river. Back in the 1960s and 70s, it's estimated the pulp and paper mill dumped 9 tons of mercury into the water. The researcher says his evidence indicates it's not mercury flowing into the water now, but that the pollutants are again coming from the mill.
There are no other industrial sources. There's no other sulfate coming from anywhere else. So this is the source.
The company that owns the Dryden paper mill, Dryden Fibre Canada, says it only recently acquired the mill from another company, Domtar, and says it couldn't comment as we have not seen nor have we been briefed on the report.
We want action. We want something to be done. This has to stop. The polluting has to stop. So either shut the mill down or get your act together and find solutions.
The chief of the Grassy Narrows First Nation says he's one of the people who's dealt with the effects of mercury poisoning. For him, he says, it's been a lack of coordination and shaking. According to data, 90% of people living there have symptoms. People have protested, demanding changes for years.
We've been asking for a river cleanup, and now is the time, especially with this report, that they should take seriously about cleaning up the river.
A statement from the federal government focuses on the millions of dollars it's spending on a mercury care home on Grassy Narrows. Construction is set to begin in July and take 2 to 3 years. The Ontario government says it's committed to working to remediate the mercury contamination. It says it has experts now going through this latest report, and it'll be meeting with the researcher and also Indigenous communities next week. Lorenda Redicop, CBC News, Toronto.
Well, my next guest says that she's surprised that it's taken this many studies for people to acknowledge the issue when she and her community have known about it all along. Judy Da Silva is the environmental health coordinator for Grassy Narrows and suffers from symptoms of mercury poisoning. She joins me tonight from Kenora, Ontario. Thanks for being here.
Thank you for asking me to speak.
Judy, what stood out to you with this new study?
Well, what stood out first is that to hear that there's actually a chemical that intensifies the mercury. We always knew there was mercury, and that was dumped. 10 tons of mercury is dumped in the water, but now this is our first time really hearing from a scientist that the chemical that makes it more toxic is being used in the mill.
You live with mercury poisoning yourself. What symptoms have you experienced, and how has this affected your life?
The symptoms I have are loss of coordination. Like sometimes, it's almost like a dizzy spell, but it's more intense than that, and you just lose your balance. And the other thing is the neurological effects, like my loss of sensation in certain parts of my body, or trouble swallowing is the scariest for me right now, because sometimes I'm eating and then my mind forgets how to swallow. And it's even come to the point of water, like when I'm drinking something, so you just start choking on whatever you're trying to ingest.
That's got to be very scary. You grew up in the community. How did you see mercury poisoning affect it as a whole over the years?
You mean in myself or in the community?
In the community.
Like, community members? I guess community members, like, it's hard to actually see like how it affects them, because like you look at a person and they look normal, but the neurological effects are invisible. So like it's like tunnel vision. Like you can't tell when somebody has tunnel vision, and our people are so resilient and Anishinaabe that they don't show that, you know, that they're having tunnel vision, or they don't show that they're having consistent, or they call it like headaches all the time, or loss of hearing, or heart problems. The neurological effects from mercury poisoning is like far-reaching in many different ways. It almost looks sometimes to like diabetes, or dementia, or Parkinson's, or Alzheimer's, but it's mercury poisoning.
This exposure has been linked to the community's high attempted suicide rates in youth. What have you noticed when it comes to that crisis?
The crisis is like really a sensitive issue for me, because like I've personally lost relatives to suicide, and like to see the family suffering from the loss in their family from suicide, it's really horrific for us. And like if you Google Dr. Donna Mergler, you'll see the reports online of like how she came up with those. We did a community health survey with the community members, and it was almost like a prophetic report when she did that, because like shortly before that, a young person had committed suicide when she came out with that report. So it's been like a really devastating effect to know that, you know, this is how mercury is destroying my people.
What is it that keeps you and others in the community in Grassy Narrows despite all of these health challenges?
I guess I give it back to the people and say, you know, my people are very resilient, very strong, courageous people, and with the mercury poisoning and how it's affected their daily lives or their economic or social thriving, you know, effects. You know, like we would be, if there's no mercury poisoning, we would be doing commercial fishing. We'd be able to take care of our relatives in a good way, but with mercury poisoning, it has taken that away. So like if you come to Grassy, like you wouldn't tell from the community members that they're suffering from mercury poisoning.
Judy, appreciate the time this evening. That is Judy Da Silva, who is the Environmental Health Coordinator for Grassy Narrows and has suffered symptoms of mercury poisoning.